MPs will vote today on new laws to phase out young people smoking. It would mean that children aged 15 and under will never legally be able to buy tobacco.
And new powers are also being introduced to restrict vapes. They will restrict the flavours, packaging and displays after a rise in the number of people, children in particular, taking up the habit, which follows early data from the first major study on the long-term impact of vaping on blood vessels, which found vaping does do damage.
And England's Chief Medical Officer, Sir Chris Whitty, joins us now.
Morning.
Good morning, Sir Chris. Just on this issue of vaping, my father is a professor of medical cell biology, in his 80s now. He's been saying to me for years that we were getting it wrong on the advice about vaping. Of course, smoking's bad, but we were giving the impression that vaping was better and therefore OK. Do you think that, in retrospect, looking back in the last 5 years, we gave people the impression vaping was safe, when in fact it's not?
Well, I think that you've said sort of two things, that vaping is better and that vaping is OK. Those are two different things. I think we are confident that vaping is safer than smoking, but that is only because smoking is so extraordinarily dangerous. I think you've got to sort of just think through all the things that smoking does, all the way through your life course, from stillbirths right at the beginning of your life, asthma in children, through heart disease, stroke, dementia, lung cancer, still our biggest cause of deaths, multiple other cancers. There are so many different things that smoking does. So saying you're safer than smoking is really setting an incredibly low bar. Smoking is dangerous, and it is also, and this is the second key point on this, highly addictive. And the problem for people who are smokers is that coming off smoking is incredibly difficult. This is the reason why those who say, oh, this is about choice, completely misunderstand smoking. People who've become addicted to smoking at a young age find it incredibly difficult. Their choice has effectively been taken away. If you're pro-choice, you really should be strongly against addicting generally children and young people to something which will very possibly kill them or cause their lives to be miserable for years or indeed decades. On the other hand, vapes are not things that I or anyone I know have called safe. And my advice has been really clear, which is if you smoke, it is sensible to use vaping as a quit aid if that helps you. But if you do not smoke, do not vape. And above all, it is absolutely unacceptable to be marketing vapes to children, which it is very clear many of the vapes companies are.
And that's a tougher message than we were giving 5 years ago, that your predecessors were saying?
I think if you talk to my predecessor chief medical officers, they would very much give exactly the same message. And all the living chief medical officers from England, Wales, Scotland and Northern Ireland wrote a letter laying out exactly these points about 3 weeks ago.
That's so interesting. So the message is very clear. If you smoke, vape instead. If you don't smoke, don't vape.
Absolutely.
Just don't vape. But
don't vape. And marketing to children is utterly unacceptable.
Well, and that... OK, so local newsagents, you don't have to go to a specialised vape shop. You can just go into a local newsagent. And even though the cigarettes have that now cover over them so you can't see the packaging, there is, on the counter of a local newsagent, absolutely tons of pink, pale blue, pastel-coloured vapes for sale. I mean, they just look like sweeties and they are sold on the counter next to sweeties. So what's going to happen with those, the vapes?
So that's one of two things that the bill which is being voted on in Parliament today, which I think the overwhelming majority of doctors, nurses and health professionals hope MPs will vote for, is going to address. So on the vape specifically, as you say, the way that vapes companies are marketing these to children is through colours, through flavours, through using disposables, cartoon characters, placing them in particular ways that appeal to children. And what this bill will do, along with the smoke-free generation, is to make it possible for ministers substantially to restrict the numbers of colours and flavours and also have plain packaging and put them potentially behind the counter so that it is possible to make the attractiveness of vapes much smaller than it is at the moment.
Oh, the other problem with vapes is that whereas if you smoke, you might have a couple of cigarettes a day. Obviously, some people chain smoke. But vaping, because there's really no restrictions on where you can vape, you can have a vape in your hand and in your mouth pretty much all the time that you're awake. It actually must have such a damaging effect on you because you just do it constantly.
And this is why we really want to get back to what the vapes were originally designed for, which is simply as a quit aid to help people who've got the incredibly dangerous addiction of smoking, which is likely to kill them or injure them, to move over to a safer but still not safe intervention, rather than have them as a kind of just an accessory and sold as just, as you say, like sweets for children or something which is extremely trivial to adults. These are not trivial products. They are to help people stop smoking, and that is really all they should be.
And just in terms of the medical evidence, you are the Chief Medical Officer. What is the medical evidence on the damage that vapes will do to you? Either a disposable one or, I mean, I honestly don't know the difference between a disposable or a non-disposable vape. What is the evidence? Because whenever we do this story, we get tons and tons and tons of parents in particular glued to the screen because they feel like the message about vaping is harder to get across to their children than the message about smoking. So what would you say to them?
So the reason that we are confident that vapes are safer than smoking, other than the fact that smoking is so dangerous, is they do have many fewer chemicals in them, chemical toxins. Smoking has got an extraordinarily large number of carcinogens, which are things that cause cancer, and other damaging products. But vapes are not themselves safe. They have, the majority of them have nicotine in them, which is certainly addictive and may well have longer lasting effects on developing brains earlier on in life in children. And we don't actually know the extent of the long-term effect of vapes. They have not been around for long enough to say at 30 years, at 40 years, at 50 years, this is what happens if you vaped continuously. So I'm very strongly of the view that if people are moved from smoking to vaping, which is a step very firmly in the right direction, they should then try and move down to no vaping at all. But that's the key thing, is get off smoking for the smokers. But for everybody else, you really do not know what this is going to do to you in the long term, but we know that multiple things, if you inhale them compared to if you eat them, can be extremely dangerous. That's why, in fact, why air pollution is so dangerous. It's inhaling things. There's very little barrier between the outside air and the blood. And we do not wish people who are not smokers to start vaping on health grounds.
Can I ask you about the smoking bill in Parliament today? This is very radical legislation, going to essentially phase out the legal buying of cigarettes year by year, so that today's 15-year-olds will never legally buy a cigarette in the UK. So it's a very radical move. You know, I know that you strongly support this legislation. The last Prime Minister, Liz Truss, called it an example of the nanny state. Her predecessor, Boris Johnson, said a couple of days ago it was absolutely nuts. What is your message to Liz Truss and Boris Johnson, former Prime Ministers, about this legislation?
Well, with great respect to the former Prime Ministers, and of course I've got great respect for Mr Johnson, who I had the privilege of working for, those aren't arguments. What we need to do is be really clear. This is a very serious public health question. We know that large amounts of heart disease, cancer, stroke, dementia and problems in pregnancy, for example, are caused by smoking. And we know that it's based on addiction and therefore people's choices being taken away. And calling things names, whether it's nanny state or nuts, doesn't matter, isn't really a serious argument. The other argument that Mr Johnson appeared to be advancing, the only other argument, as far as I could see, he was advancing, was that in a very different era, the great hero Sir Winston Churchill smoked cigars. I mean, that was at a point when health driven by very high smoking rates was very, very much worse. And I think we would all admire Sir Winston, but not wish to go back to 1940s and 1950s health.
The other sort of argument against is that this was introduced in New Zealand back in 2022, and then as soon as the government changed, was overturned. And the new Prime Minister, Christopher Luxon, said that the reason that they'd overturned it was because they wanted to prevent a hidden tobacco market cropping up and stop shops from being targeted for crime. Look, I suppose the thing is, if you ban something, then a black market emerges. Is that an argument that you've considered?
It's an argument we've considered, and the reason that we are confident it is a bad argument is that every time there's... the last time, for example, we had a significant change in smoking legislation, as you would expect, demand for cigarettes went down, and therefore the illegal market went down. So the evidence is when you have measures that reduce demand for cigarettes, actually the legal market contracts. Now, the cigarette industry always puts this out as a scare story, but there's no evidence to back it up. And in this particular form of legislation that's before Parliament today, nobody who currently smokes is going to have any change to the law. So there's no reason why people who are current smokers are desperately going to be going for illegal cigarettes, because they can carry on smoking and be sold cigarettes legally, and will be able to continue to be sold cigarettes legally till the end of their days. So I don't think this argument really makes any practical sense, and the evidence from previous examples is in fact the exact opposite happens. By reducing demand, you reduce the illegal market.
And it looks as though the legislation will go through the House of Commons today. Can I ask you just one other question? The COVID inquiry, you've given very important evidence to that. Rightly, it's going to take a long time, won't report for years, but there could be another pandemic this year. I mean, we don't know. You're the Chief Medical Officer. You'll be thinking about that all the time. I've asked the last two health secretaries, Steve Barclay and now Victoria Atkins, what's the one lesson they've learned which they would do differently from March 2020? And to be honest, they didn't really have an answer to that. But for you as Chief Medical Officer, what's the one thing you would absolutely do differently now to March 2020 if another pandemic broke?
Well, I think there's some sort of questions about what we do if we reran the clock. And I think I've said in the inquiry, others have said, we would probably have locked down slightly earlier, not a huge amount earlier. There are a number of other changes we would have made on this one. But I think it's really important that we don't assume that if we learn all the lessons from COVID, that'll make it possible for us to do the next pandemic in a brilliant way. Because the last pandemic, if you think about it, that was really serious was HIV/AIDS, and that was a sexually transmitted infection largely affecting young adults, 100% mortality when it started, a very different sort of disease. What's common to them is the ability to scale up. And I think one of the things that I always worry about is that in every country, this isn't a UK issue, during the crisis, people say, never again, this time we're going to invest in public health. And then the crisis passes, new emergencies arise, and that enthusiasm for ensuring we actually have the skills, we have the capacity to scale up, are dissipated over time. And that, I suppose, is the worry. That's, to me, the biggest lesson. Is
our public health capacity stronger than in March 2020 today?
It will be, the question will be, will it be stronger in 5 or 10 years? And that is a political decision. I really hope that it will be. But the risk is that we're good at managing another COVID crisis, but we haven't invested in the capacity to scale up if we had a different sort of a crisis.
So right now it's not stronger than in 2020?
I think right now it is stronger, but my worry is that we could easily fritter that away.
Right.
Professor Chris Whitty, thanks very much. Just before you go, the UK Vaping Industry Association says much more should be done to prevent youth access to vaping products. They said we've long called for a licensing of retailers, much more meaningful and stronger fines for those who sell vapes to those under 18. And in the coming weeks, we'll submit a plan to government with detailed proposals for tighter regulation. Does that make you feel more reassured?
No. I mean, I think that if you look at, the vaping industry, and I'm sure there are some very, very responsible vaping companies whose only aim is to help smokers to quit. But the vaping industry is saying it's all about enforcement. Look at the products. That's the question. Look at the products. Look what's happening to vaping rates in children. They have clearly been marketing to children, whatever people may say. Professor
Sir Chris Whitty, good to talk to you this morning.
Thank you very much.
Thank you very much indeed.
Thank you very much indeed.
Right. Have you been smoking 20 a day? Your voice is really damaged, isn't it?
I'm really sorry. Is it annoying?
No, you don't need to apologise. It happens to all of us. I had to take time off work because I lost my voice.
I've had this, I think it's going round. I've had, you know, I had a kind of a flu-y thing about a month ago.
I know.
And then the cough has persisted and it doesn't go away and it's in my throat.
No, but I have heard people describe it as the 100-day cough. No, there is no need to apologise. Well, it just does sound like you're a chain smoker.
But
can you confirm or deny that you buy...
I am not a chain smoker.
No.
And I've never
Are you a
vaped.
vaper?
No, because my dad said to me, as I said, an expert in these things, a medical cell biologist, 10 years ago, he said, putting stuff from a vape into your lungs when we have no idea what it does, there's no evidence, and he was always worrying that better than smoking, fine, that gives the impression that it's OK. It's not OK.
No.
But no, I don't smoke and I don't vape, but I'm very sorry for my husky voice.
No,
it's really annoying.
No. I like the husky voice.
Whoa.
Oh.
I'm very sorry.
No need to apologise.
Husky voice.